Unfortunately, the funding that we have that is distributed through DHHS does not assist with repairing a meter. However, there may be funding um, coming for the 25 counties that were impacted with the IA declaration, the initial 25 counties. There may be funding coming that we could potentially assist with things like that, but that is forthcoming information. But currently, our crisis programs would not assist with that, no.
Thank you, Allison. And I think we have one more question in the Q&A that we're going to be able to answer. Carolina, do you mind?
Sure. So we have a question asking about individuals who are receiving Sunbucks. Perhaps we can elaborate on that program.
Sure. So Sunbucks is a summer program. This is the first new program from USDA in over 50 years. This program provides a one-time benefit to school-aged children during the summer months to assist with purchasing meals while they are out of school. Um, Last year for 2024, the benefit was $120. We do know that there may be some changes with that amount coming in 2025. And so to be eligible for Sunbucks, households must be receiving free or reduced price meals through the National School Lunch Program. And they can receive those Sunbucks benefits. Another way to become eligible as well is if households are receiving, in addition to the National School Lunch Program, free or reduced price meals, they can also be receiving food and nutrition services or TANF benefits to be eligible as well. And those households that receive those two, they're automatically eligible to receive the Sunbucks benefits. However, there are some households that will have to apply. Our application period for 2025 is open. Households can submit an application, and they can do so by going to the Sunbucks website. And I can drop that, LaDonna, if it's helpful in the chat, so that households can go online and apply for those benefits.
Thank you. Thank you so much. I see a kind of like a follow-up thread asking about immigration eligibility for these programs. Is that something we might possibly elaborate on?
So I would have to take that question, Carolina, back and provide a response to you.
Thank you.
Thank you.
Everybody, thank you for your questions. And to keep on time with our agenda, we will move forward. But note that any question that is put into the chat, into the Q&A, excuse me, we will get an answer to you. Thank you very much.
And just as a reminder, if you are on your phone, you can just press 0 at any time to stream in your question. Thank you all so much for your answers and for your support with that valuable information. We also know mental health and health in general is a huge part of recovering from a natural disaster. In addition, services for those with disabilities are particularly important. With us are Brittany Jones from the NCDHHS Mental Health, Developmental Disabilities, and Substance Use Services, and Lauren Howard with the Office of Disability and Health. We also have Erin Fry-Sosney with the Department of Public Health. Brittany, what mental health resources are available to those impacted by Hurricane Helene? And is there also support for those helping with recovery?
Yes. So good afternoon, everyone, and thank you, Carolina. So I just wanted to provide y'all a update of the ongoing response that we're doing for Hurricane Helene from the division. So we're continuing to work with the local management entities and managed care organizations to support Hope for NC, which is a phone line that people can use and call to get connected to mental health resources, and particularly those who are helping with hurricane recovery, so first responders and that sort of thing. So It's free, it's confidential, and available 24 hours a day, 7 days a week. That phone number to connect to Hope for NC is 1-855-587-3465. 63, Um, so we have Hope for NC to support those who are helping with the recovery. We've also started training crisis community workers who will be starting boots on the ground in the community in the next couple of weeks, connecting people in the community to mental health resources. So that will be starting in the next couple of weeks. We're also continuing to work with the local management entities and the managed care organizations and the community providers to ensure that the service flexibilities that are currently in place are meeting the needs of the community for the mental health services. So continuing to have ongoing discussions with those providers and the LMEMCOs. Finally, crisis services continue to be available in the community and can be accessed by texting or chatting or calling 988 or reaching out to your LMEMCO. And then also, resources can be found on the DPS.gov/Helene website as well.
Thank you, Brittany. It's such an important time to take care of our mental health. For those with disabilities that may still be faced with not having access to their normal support systems, even nearly 2 months after the storm, Lauren, can you share what resources are available to help these North Carolinians?
Sure. Thank you so much, Carolina. Yes, there are lots of resources available, but I just wanted to highlight a couple for you all to be aware of that will continue to be available to support people with disabilities throughout this long recovery process. One is an organization called Disability Rights North Carolina. This is a protection and advocacy agency that is statewide, but they have a very strong emphasis on disaster recovery and connecting individuals with disabilities to local resources addressing unmet needs, helping with housing and transition, as well as ensuring that the rights of those with disabilities are protected. And so we'll make sure that in the chat, as well as in the information provided after this meeting, that you have the link to Disability Rights North Carolina website. You can also call them directly and ask questions or raise any concerns that you have. And they have a really extensive list of resources on their website that are geared toward those with disabilities and have proven to be very, very helpful. So wanted to bring that to your attention. The second resource is called the Disability and Disaster Hotline. This is managed by an organization called Partnership for Inclusive Disaster Strategies. It is a national organization, but because their focus is disasters, they have been providing a significant amount of support to those who have been affected by Helene in North Carolina. And they have a hotline phone number that we will also put in the chat, as well as an email address that you can contact them again with any concerns, questions. There have been reports of people having difficulty when applying for FEMA and getting requests for additional information needs. And this is where an organization, either Disability Rights North Carolina or the Disability and Disaster Hotline, can help individuals with FEMA appeals and filling out information and documentation. And so they really are both amazing resources for advocacy and meeting the needs of people with disabilities. And the third organization that is important for communities to be aware of are Centers for Independent Living. And these are non-residential, community-based organizations that support people with disabilities to live independently in the community. And there are centers across the state. They do not cover every county, but they cover most counties. And there's in particular a Center for Independent Living in the western part of the state called Disability Partners that has been providing support to those with disabilities in the Asheville and Silva area and those surrounding 14 counties in the western part of the state that were affected by Helene. And they can be a point of contact to, again, connect with information and resources that are needed, address any unmet needs that individuals with disabilities have. And I also just wanted to make this group aware, since many of you all are community partners and community-based organizations, that we have been meeting on a regular basis through this event as a disability integration call. We meet weekly at this point in time. And the point of this call is to bring together partners, those who work with those with disabilities, those who are just concerned community members, to share information and address any unmet needs that are occurring specifically related to disability. So if anybody on the call is interested in joining, it is an open group, and we're more than welcome to have you join us. So unless there are any other questions, that's all that I had to share.
Thank you so much, Lauren, and thank you for extending that invitation to our audience. I know LaDonna and I, we've been in those calls and they have been very helpful in streamlining resources. So please consider joining those weekly calls. Brittany, Lauren, and Aaron, we have a few minutes to answer questions about mental health, disability services, or health and safety in general. As a reminder to those on the call, please submit your questions or comments in the Zoom Q&A, or if you're joining us by phone, press 0 on your phone keypad at any time. LaDonna, do you have any questions from folks you want to try to address?
Yes, I think there are actually a couple questions in Spanish, if you don't mind, Carolina.
Okay, I see this question might be for Brittany. Are there resources for mental health that you mentioned also available in Spanish?
Yes. So in particularly, I know that 988, when you call, text, or chat 988, you can be connected to a Spanish speaking line. So when you dial the number 988 on your phone, it will, you'll get a message prompt that says if you need services in Spanish, to hit I think it's the option 1, and it'll take you to a Spanish speaking line where you can access crisis services from there, or mental health services from there.
Thank you, Brittany. And this next question might be for Lauren. The question is, when there are folks with mental disabilities in a hurricane shelter, does the shelter have to take additional precautions or considerations to support individuals with disabilities?
So yes, the shelter will definitely provide any accommodations that are needed for an individual with a disability that is located, that is in a shelter, whether that be for physical disability and mental disability, just whatever that is needed. Many shelters, there aren't any open at this point in time that are general population shelters, but many of the shelters, when they were open, also had mental health support in the shelters, anticipating the needs of folks during that initial response time related to mental health. But again, to answer the question, whatever accommodation is needed in the shelter related to disability is something that it is provided.
And to that effect, Lauren, the follow-up question on that is, are there support systems or resources for individuals with disabilities without an immigration status who may have been affected by the hurricane?
I know that there are, in terms of the specifics of that, I can definitely get more specific information and circle back to that question if that's okay to do that.
Yes, and even the space that you shared the weekly call where we're discussing a lot of what we're encountering. This is an invitation to maybe bring that up in our next meeting and see what our partners are able to leverage on that front. We know that it's been brought up a couple of times at different scenarios that community members are experiencing, especially when accessing other resources like FEMA or their inability to access those. Thank you, Lauren.
Absolutely.
Well, thank you. I'm trying to see if there's any other questions in here regarding, there is, sorry, Carolina, there's one more question in Spanish, if you don't mind.
Okay, it's a similar thread. Are there resources for folks who are the resources only available for those who are documented, or are they also available for those who may not have documentation? Are there resources available, and what kind of resources? I know, Brittany, you shared the 988 hotline as an example of that service that's available in English and Spanish, and anyone can call and
So
access mental health services. Go ahead.
correct. So 988 is confidential, so you can call and tell whatever information or no information that you feel comfortable sharing. So you don't have to say anything about yourself, where you live, any kind of immigration status or anything like that. So that should not impede your being able to be connected to resources.
And then to follow up with that, Carolina, I know that it's going to depend on the type of organization and the resources that they do provide. And so what I will do is work on a list that we can include in the follow-up that provides some specification as to maybe highlighting a couple of those that are good resources for those that may be undocumented to start with.
Thank you, Lauren, and thank you. I believe that was Karina with that question. Thank you so much.
And also, I think there was a comment from Alfred earlier in the Q&A about how legal aid is able to provide support for appeals with FEMA applications that are denied. So we have one more question here. How do we report violations of disability or mental health support at shelters? In Burke County, the sheriff's office refused homeless populations access to the shelter prior to the storm, and the local charity had to purchase hotel rooms, which is tangential to disability support, but presumably there is some degree of overlap.
Yeah, so to answer that question, the first place that I would direct you is to Disability Rights North Carolina. Let them know of the event, and they are probably best positioned to be able to respond to that appropriately in terms of what could have been done better, what we need to, in many cases, in some of these instances, it's what we need to learn and do better next time, since that event has actually already passed. But I would definitely start with alerting Disability Rights North Carolina as to what happened.
Thank you, Lauren. We have another question here regarding primary care services. This is a good question. It's hard to fit it in our agenda because we don't have it specifically addressed, but I just wanted to read it out from Peter, that St. Joe's Primary Care has been providing free primary care in Mitchell County for nearly 4 weeks. Is there a way to work with the DHHS so that they can continue to support neighbors in Western North Carolina? And I don't, I just wanted to call this one out because I'm not sure if we have the right person on, Peter, to answer that question, but want to make sure that you know that we'll take this back and look into this for you, unless any of our subject matter experts are on that can help address it.
And this is Yvonne. I don't necessarily have the answer. I agree that we need to take it back to find out, get a specific answer. But I would also direct people to the local health department. Some provide some primary care services, albeit not typically on the weekends, but I don't know what they may be doing, but just don't want to forget that resource may be available to some.
Thanks, Yvonne. And then there's one more question in Spanish. Carolina, this might have to be the last question before we move on to our next section.
Thank you, LaDonna. This is such an important question, and thank you to our attendee for raising it. The question or comment is, what can we do to humanize or create consciousness around the situation that individuals without documentation are living, those who are contributing positively to the economy of North Carolina? I know that is perhaps not directed to any of our previous panelists, but I think your participation in these calls and in these listening sessions, where you're bringing up the vital need to acknowledge and uplift the voices of those community members, is a way that we can continue to find those resources and streamline the connections between nonprofits, philanthropy, local government, state government, federal government, all of those that are on this call that are listening and working hard day in and day out to find the answers to some of those very, very challenging and complex questions. So if anything, I thank you for raising that concern. I know that we're going to be following up with resources, and as Lauren shared, we're going to be working together to make sure we can delineate some of those that are available for our different community members. So it sounds like we also have a phone question coming in. We have a quick minute to take the phone question. This is Joy from Jacksonville. Joy, can you hear us?
Yes, my name is Joy Cook. I'm a returning military member. We were down there activated since 17 October in Hendersonville, Batcave, and Chimney Rock. I'm with the 145th Air National Guard. We worked out there, with FEMA and also another Army unit. And my question was, how can other nonprofits that want to assist with this recovery, how can they partner with larger organizations such as DSS? I'm asking that because I'm also the secretary for the Onslow County NAACP, but I know there's one in Henderson County and, of course, other surrounding counties. So I just wanted to know the process for saying, like, for example, if we said, hey, we want to come alongside, or we have financial resources that we can help once the resources that have ran out, with DSS, to where we can assist. So how can like a smaller organization, well, NAACP is not a small organization, but how can organizations such as NAACP partner with like DSS to be able to help those Spanish and English with financial assistance, mental health, and all the other resources that are needed?
Thank you, Joy, for your question and for your service and all the work that you contributed to those counties. In the chat, it sounds like Alfred is contributing the information of the NC-VOAD calls in case your team is not already connected to those. Those are coordination calls that are set up for usually on a weekly basis, and they're recurring calls. And so there's an invitation to join. There's various groups. There's a long-term recovery group. There's a Helene response coordination call, a disaster case management call, and an emotional and spiritual care and child well-being call. So I'm just uplifting that. We're seeing what may be a response to your question in the chat, bringing up the NC-VOAD recurring calls where coordination and collaboration is happening on a regular basis.
Okay, I'm on the phone, so I can't see anything in the chat. Is there a way that could be emailed to me or text to me or anything?
Yeah, I think we can, is there I don't know if Alfred can maybe elaborate on in the chat for us. It's ncvoad.org.
You said it was what again?
ncvoad, ncvoad.org.
BOAD.org. Okay, and what website is this?
This is their coordination calls that are happening on a regular basis. There's a large group of different categories and populations that they serve, from emotional and spiritual care to disaster case management. I know they also have a diversity call. So I believe you can find that information on ncvoad.org.
Okay, and that was V as in Victor, OAD.org.
That's correct.
Okay, no problem. Thank you.
Thank you so much, Joy.
Caroline, I just want to make sure that we understand that James put it in the chat, but VOAD stands for Volunteer Organizations Active in Disaster. And so I think with that, I really appreciate all of these questions in the chat. And we do have sections in the agenda where we're going to talk about housing and the future, the next steps in the long-term recovery process, as well as hear from some of our nonprofit organization partners, community partners, such as United Way and Red Cross. With that being said, do we feel like we're at a good spot where we can move this to the next section?
Yes. Thank you. Yes, thank you, LaDonna. If you're on the phone, please stay on the line for your housing questions. We'll be trying to get to all of those shortly. As we approach the start of the third month of recovery, many of our thoughts are turning to the transition to long-term efforts to restore and rebuild so much of what has been lost. With us is Laura Hogshead from the North Carolina Office of Recovery and Resiliency, or NCORE. NCORE was established by Governor Roy Cooper in the wake of Hurricane Florence to lead the state's efforts in rebuilding smarter and stronger. Laura, what do Western North Carolinians and those working to support the recovery efforts need to know about what is coming next?
Thank you so much for including me, and I'm happy to be here to share information. My information is a little less immediate than the previous speakers, so I want to make sure that we recognize that we're transitioning into the longer term conversation now. So NCORE, the North Carolina Office of Recovery and Resiliency, will eventually have a lot of money for housing, but we don't have it yet. And so that's the frustrating part. Congress physically has to act and appropriate funding for HUD to give out for disaster recovery. It is called Community Development Block Grant for Disaster Recovery, or CDBG-DR, which none of you need to learn. But what it is a large block grant that the state will get after Congress appropriates and after HUD allocates the money for long-term housing recovery. You might have seen our work in Eastern North Carolina. Again, this is the last funding. So this is the bigger pot of funding that can help actually replace mobile home units, rebuild homes, elevate homes. It can do a lot, but it comes later. And so the most important thing that you can do right now in order to get into the line for those funds is to register with FEMA, to register through IA, and make sure that all of your information is current. You can also make temporary repairs to your structure if it is safe for you to be in your home. And you, as a volunteer organization, can help folks make repairs to their homes. We just want them to be temporary so that when we come back in with the federal money, eventually, when it is available, we won't be tearing out a lot of work that someone has done. But we do want people to be safe and warm this winter while we wait on this bigger federal resource. So again, the most important thing you can do is sign up with IA. NCORE is also starting up disaster case management. And so we will be advising folks on the ground about how survivors and families and organizations on the ground about how to navigate all of these federal systems. There is no reason everyone needs to learn every acronym that we're throwing out at you right now. We want to help you through that process, but that again is moving into the longer term recovery. Someone put in the chat something really important that I want to make sure we say. Keep your receipts, Take photos before, during, and after, and make sure that you hold on to as much paperwork as you can hold on to, especially if you are making temporary repairs to your home. In all likelihood, we will be able to use HUD funds to further repair your home, and we won't have to worry about a duplication of benefits, but having that documentation is really important, and having that IA registration is really important. So document, sign up for IA, and we will be in touch because we have a data sharing agreement with FEMA. So if you've signed up with FEMA, HUD will know who you are, and we will be reaching out to you to do the further assistance. FEMA can only do so much in terms of housing repair. The maximum award is $42,500. That is not going to get someone home if their house was destroyed. The HUD funds can be the backstop that help you get home. They just aren't here yet. And so I hate to be that person on the panel that says we're not there yet, but we're not quite there yet. The most important thing you can do is sign up for IA, individual assistance, continue to work through the FEMA process, and once disaster case management is on the ground, work with your disaster case manager to identify what the correct resources are for you. We want to help you not have to learn all this rigmarole, but get to the next best step in your recovery. And so document, save receipts, sign up for IA, and once the HUD money comes through, we will be able to find you and help you with that process.
And just to add, IA is individual assistance. I know it was shared in the chat that resource has been shared. Thank you so much, Laura. The recovery from Helene will take a very long time, but we're here to support Western North Carolinians for the long haul. While we may not have all of the answers for every particular situation, Laura, thank you for being available to answer questions as best as possible and listen to any comments that our community is sharing. Again, just a reminder to submit your questions or comments in the Zoom Q&A, or if you're joining us by phone, just press 0 on your phone at any time. It sounds like we have a phone question now coming in from Diane in Henderson. Diane.
Hi. Hi. This is Diane. Are there any programs available for renters who can no longer live where they were?
So for renters,
and what are they?
Yeah, I understand. For renters, we still encourage renters to sign up with IA. There will likely be programs for renters, although the HUD money is more geared towards homeowners. There will likely be programs for renters. The key is to know who you are and where to find you once the federal money comes through. So again, sign up for FEMA, take pictures, keep documents.
Is there an ETA on when that's going to go through Congress?
That is a very good question. They are supposed to be meeting this week into next week to determine what their allocations might be. There is a hearing in the Senate today. The president has made a request of almost $100 billion for all this disaster recovery. That's not exclusive to Helene. That's for every disaster that has happened in the last 18 months. But they're having the hearing today and Congress is in session right now. Not clear whether they are going to actually appropriate this week or if they are going to wait into December, but it is not immediate at this point.
And so just to follow up, so right now there aren't any current shelters or programs available for somebody who is renting and lost everything.
No, everyone should be going
correct?
to any shelter that is open. It's just that the HUD money has not come through yet. So any shelters that are open and being run by your county, by DSS, by Red Cross, everyone is welcome at those shelters. Renters, homeowners, everyone is welcome. And so to get into the shelter and to get into that individual assistance process is the key. Everybody should be taking advantage of every available shelter that there is and making sure that they're signed up with FEMA. FEMA will reach out with the benefits that are available from FEMA. And once we have the HUD money, we will also reach out with what benefits are available from HUD.
Final follow-up on that, are there any shelters available when folks have pets? Because I'm seeing a lot of people sleeping in their cars because of that.
Yes, over the course of the disaster, there have been pets in shelters. I would need to check to see which shelters right now are still accepting pets, but that was a great need right after the storm. And so we'll check back to see if there are shelters that are accepting pets right now.
Okay, thank you.
Thank you.
And I know our upcoming panelists will be elaborating some on shelters, but LaDonna, do you have any any questions in the chat that you want to address. And thank you so much, Diane, for your question.
Yes, I'm sorry, I'm trying to find it. There was an influx of questions just right now, so I lost my place. I apologize. I think that there was a question. Sorry, I lost it again. I think there was a question regarding rush funds for homeless populations. Are you able to address that, Laura?
Certainly, yes. The rush funds, rapid unsheltered sheltering support is from HUD. That is a $3 million pot of funding for the continuums of care that are already active in the disaster area to house those who were previously homeless, who were homeless before the storm. And so we are working with those funds, working very closely with DHHS on those funds to get them into the right hands. Really, what needs to happen is that you need to go to your normal homeless resources. They are available for you through the normal homeless resource network. And if I can put into the chat any of those resources, I'm happy to.
Laura, please do, and thank you very much for that, because we will collectively send this out in a newsletter to the attendees in a broader community partner audience following this call.
May I also have a call on the phone if Cynthia's still on, a question from our phone line?
All right.
Yes. You mentioned something about disaster workers and social workers and care managers. How do individuals sign up to be part of that team?
Oh, I'm so glad you asked. I will put the job posting in the chat because we are hiring locally. We want to hire Western North Carolinians to help their neighbors. And so I will put the link for that job posting in the chat. And thank you for asking it.
And there are actually...
I am on the phone, so is it possible for me to get that information when the mailing come out, or how would I make sure that I'm on that mailing list?
I would kick that question to LaDonna, but I think that all the resources will be shared with the folks that are on this meeting. Is that right?
Yes, that is correct. And if you are unsure if you're going to be mailed on the email list, you can reach out to us. My email is ladonna.hufffaker@dhhs.nc.gov.
Could you repeat that, please?
LADONNA.HUFFAKER@dhhs.nc.gov.
Thank you.
And Laura, we have another question for you here. While we wait for HUD funds, the info to take photos, documents, keep receipts, how is that being shared out? Is there an FAQ somewhere, best practices or tips that can be shared to survivors?
Certainly. I will also post in the chat a flyer. One side is for homeowners, one side is for VOAD groups about how they can make sure that they are not cutting themselves out of any future benefit, and it has all the guidance about taking pictures. So let me put that in the chat as well. Or actually, LaDonna, I'll send that to you to be sent out.
Thank you very much. All right. I think as far as questions for you, Laura, I think that's all the ones that I see here. I do want to just call out a previous statement for mental health. Jose says that Hispanic Federation is providing free mental health assistance to the Latino community via hotline. And so thank you for putting that in the Q&A, Jose. And I just wanted to make sure I called that out.
Thank you. That's right, LaDonna. Hispanic Federation is providing that mental health assistance. This is also a bilingual hotline, so anyone can call in Spanish. I know that the mental health resources are actually available in English, Spanish, and Arabic, and that phone number is 1-844-438-6827. These are telehealth mental health services that are available by calling the hotline. The hotline also helps register for Medicaid expansion, and it provides a lot of really important resources to the region. So we'll make sure to share and include that in our resources as we continue to follow up.
And then I just want to say that Lauren Wilkie has said from Safe Flight has said that they are a violence abuse exploitation services, so they don't work directly with homelessness. But thank you for adding that into the Q&A, Lauren. All right, I think that is all the questions for you, Laura. I really appreciate that.
Thank you.
I appreciate you being here.
Thank you. If we were not able to get to your question, feel free to drop those in the Q&A, and our team is working as best they can to respond those. Now, we would also like to share information on relief efforts related to shelters and housing. While shelters are still readily available, we know that many are anxious to return to their homes. With us is Carlotta Dixon with the Multi-Agency Shelter Transitional Team, or MAST, Nicole Dyson with FEMA, Emily Carmody with Back at Home, and Michaela Mills with the Healthy Opportunities Pilot. Thank you all so much for being part of this call. We'd like to start with Carlotta for an update on efforts through MAST, the Multi-Agency Shelter Transitional Team. Carlotta, can you share a bit more about housing plans as we move ahead, and are shelters still available?
Good afternoon. Thank you for inviting me. My name is Carlotta Dixon, North Carolina Department of Health and Human Services, Division of Social Services. I am the CERT lead, State Emergency Response Team lead, as well as the HHS Recovery lead and the MAST lead, Multi-Agency Shelter Transition Team. And at this time, all evacuation shelters are closed. There are shelters that are open in all 100 counties, and particularly the impacted counties in Western North Carolina, for those who are needing to seek shelter from inclement weather or any other incidents that are occurring in that area. Again, but however, all evacuation shelters due to the Hurricane Helene incident are now closed. They were closed as of Friday, November 15th, 2024. And how you can reach any other shelter if a person, individual, or family, household is trying to seek shelter, you can always go to your county website, and that will list the shelter location that is open within that county if you are seeking and needing shelter. Always, you can call 211 as well. NC MAST was a team of agencies that collaboratively went out and was deployed into shelters beginning Saturday, October 26, 2024. At that time, those evacuation shelters related to Hurricane Helene were 9 shelters were open at that time, and there were 319 persons in those shelters. The team composition consisted of federal, state, and county and local resources to diligently work within those shelters, engaging individuals and families through case conferencing approach, identifying short-term housing, long-term housing, and addressing unmet needs. Solutions and resources for those individuals and families, households were provided to 283 individuals and families to transition onward to next steps out of the shelters. So at this time now, the MAST has moved to working into hotels and that have has TSA recipients, and that happened last week. So the MASS team has now converted to now what's known as TSA Outreach and Transition Team. And again, TSA is Transition Shelter Assistance. So all of individuals, households who were in evacuation shelters, part of the housing assistance was to assist them getting transitional shelter assistance by FEMA and getting them into hotels as another short-term housing solution as we work and engage with those individuals and households in identifying long-term solutions. Within that, exploring all housing assistance programs. The continued outreach will be occurring by phone, email, or in-person visit. The TSA Outreach and Transition Team will continue to assist individuals and families with housing assistance and meeting unmet needs. This work will be joined soon by also the North Carolina Disaster Case Management Program. Of the housing assistance programs that will be explored by the agencies who are supporting and collectively working together, now known as the TSA Outreach and Transition Team in assisting individuals and households, will be continuing to identify whether the individual or household is eligible for FEMA assistance, housing assistance, exploring all other housing assistance programs, as well as ensuring that those individuals and families are connected to other resources to address their unmet needs. So I think there was a question of how can individuals connect to the TSA Outreach and Transition Team, known as MASS, of the group that works collaboratively to assist individuals and families. You can reach out to 211, as well as if you are a TSA recipient, if you are an individual or a family that is currently in a hotel under the TSA program, we will be reaching out to you and continuing to engage with you in supporting how you will be able to further on identifying long-term housing assistance and meeting any other unmet needs that you may have.
Thank you so much, Carlotta. We also have FEMA with us to talk about support for those recovering from the storm. Nicole Dyson, can you provide an update on the individual assistance programs available to Western North Carolinians?
Sure. Thank you for having me. And I want to say that as I go around to the various town halls in support of the local and state communities, I am hearing more of the stories and more of the support that is needed and sharing that information back with our leadership. So to date, FEMA has provided more than $244 million to 134,000 households and individuals to begin their recovery. As someone mentioned earlier, FEMA does not make individuals whole. We do provide a start for you to begin your recovery, and we partner with other community-based organizations, other state and local organizations to provide assistance. The maximum assistance that you can receive under FEMA is $85,000. However, that is not the average grant. Most people receive between $10,000 to $12,000 if they have moderate to minor repairs to their home. So there is going to be a case-by-case basis that decision making is done by. So I encourage you not to compare your recovery to your neighbor's recovery, or say, I live right next to them, they may be getting something that I'm not getting. It is based on your individual needs, as well as the amount of insurance coverage that you may have already to support your recovery. So FEMA cannot duplicate resources from your insurance and or any other resources that you may have. FEMA has also provided assistance to the state so far for debris removal and emergency protective measures to clear roads and bridges, debris. And we've provided $252 million in public assistance. Currently, we are providing multiple temporary housing options to meet North Carolinians' individual needs. One of those programs that was mentioned was a transitional sheltering assistance program through hotels and motels, which is where FEMA will directly pay a hotel provider that has registered with FEMA. We will reimburse them directly for a stay for up to 14-day increments and longer term if necessary. The goal is to provide for the immediate needs of a survivor as we move them to a longer term housing solution. So that might look like if they move into a rental unit, or if they're able to return to their home while they continue to make repairs. It could be a number of different options. And in some cases, FEMA is providing direct housing to individuals in eligible counties that qualify for mobile homes and temporary housing. FEMA is doing that on a case-by-case basis. And also, we need to ensure prior to providing that housing that there are adequate utilities and also support, infrastructure support for the home, as well as we can get permitting and those sorts of things. FEMA is also looking at providing a commercial space where they will also have additional units that are not able to be placed on individuals' homes, their lots, so that people who may need that resource or a larger unit may be able to make use of that. This is not an overnight process, so I really do want to be clear that it is a process by which you will advise FEMA that you need assistance, homeowners assistance. There will be conversations between the applicant and FEMA, possibly a caseworker if necessary. FEMA will look at if that makes sense to place a unit on that property, or if it might be better served using a commercial lot, or if a direct housing unit may not be the proper resource at all. And in some cases, that might be true if there are ongoing utility issues, we can't get permitting and clearances and that sort of thing. So I do want to encourage everyone to utilize the resources that FEMA has provided through our disaster recovery centers. There are 21 centers currently open. They are open now from 7 to, I believe, 6 p.m. And those hours may be a little different over the Thanksgiving holidays. We will put out that information for the disaster recovery centers. But also the FEMA helpline, which is 1-800-621-FEMA. I will also include that as a resource. And then disasterassistance.gov. And I will remind applicants to, one, check your online disaster assistance account. Read the letter that you are sent based on your eligibility. Please read it thoroughly. If you need assistance reviewing the letter, please come to a FEMA Disaster Recovery Center or call the hotline. I know sometimes they can be a little bit hard to understand sometimes. We've tried to simplify them, but please know that we want to support everyone in their recovery. But there are times when we send letters that will say, we need specific information from you in order to continue your case. Or you may have missed your inspector and we may need you to reach back out to us to set up another appointment with your inspector. So because you are denied does not mean that that is the final answer. There is an appeal form that comes with your determination letter. Please utilize that if you feel like you have not received enough assistance so that we know that you have ongoing needs and we can continue to assist you. And I'll take any questions after the next speaker.
Thank you so much, Nicole, for reminding us, especially during this holiday season, as temperatures continue to drop, the importance of having a place to call home. Thank you for the work that you're doing to support all of our North Carolinians, and we want to try to answer as many questions as we can. We also have Emily Carmody with Back at Home and Michaela Mills with the Healthy Opportunities Pilot available to answer some of these questions. Well, Donna, it sounds like we might have time for a couple of questions, and then we'll want to move on to our next guests.
There is a question regarding rent assistance from Sherry Allen. And then a question on whether or not there have been organizations that have put in a request with maybe a General Assembly representative to ask for a moratorium on evictions. Before I hand this off to Michaela, I'm going to let you all know that we have collected some outside of what federal and state are supporting in housing assistance and rent assistance. We are sending out within our newsletter a follow-up on some local organizations that are also offering that support. And I'll turn it over to Michaela to answer any additional questions that she may know.
It's Emily raised her hand, though. I think Emily has something to say first.
I can just add that there have been conversations between organizations, advocacy organizations at the state level around a need for eviction moratorium. It is a known need for rental assistance, especially for people who were not displaced from the storm, but have since lost income. That is a concern that Legal Aid and Pisgah Legal are very much vocal about, and also the North Carolina Housing Coalition. So if you are interested in supporting those advocacy efforts, I would reach out to either one of those organizations to help them with those advocacy efforts at the General Assembly level.
Thank you.
And in addition, and I put into the chat for everyone, but for the Healthy Opportunities Pilot, right, that is, we do provide rental assistance, but those are for folks who are eligible through managed Medicaid for the HOP or Healthy Opportunities Pilot. And it is for individuals who are moving into a new place. So a security deposit, first month's payment. However, a lot of our network who provide that service through HOP also provide other outside of HOP services, which is what LaDonna said. We will send out some of those links as well for additional regional rental assistance.
And I'll add too, with Back at Home, we also provide case management and rental assistance. And this, I'm happy to follow up with Charlene Abbott, who asked about rush funding. Rush funding is supporting the Back at Home program in the hardest hit communities. The state set a priority population of disaster shelter households. So Back at Home went into disaster shelters along with MAST and worked through, and is still working through, the referrals of households that MAST had who didn't qualify for other programs and needed some help with a housing plan on the way out of the disaster shelters. We're still processing those enrollments and getting those households on a path towards housing. We do foresee opening up a referrals pathway from homeless systems and from disaster case managers in the disaster recovery centers. So that pathway is not open yet, but we foresee that being a pathway of referral after we are in a place where we have the disaster shelter households enrolled and on their way towards housing. So that, and then we, right now have an allotment of rush funds, and we can work within that budget. If we receive more funding from HUD or more funding from the state, we can obviously work towards serving more folks as we have more resources.
Thank you, Emily. And there's another question here for you from Courtney from Thrive. Can clients in Back at Home also be in the Medicaid Healthy Opportunities pilot? And how do we go forward with that?
That's $1 million question, Courtney, and one that we've been working at the state level for the past year on through getting federal technical assistance on that too. Michaela, I'm happy for you to take that, or I can, but it's about weaving these resources together and not duplicating benefits. That's the underlying theme. So Courtney, I know you all are both a Back at Home provider and a HOPS provider. So if you have specific questions, I think it would be good for us to take that offline. But Michaela, if you have just general guidance for folks, that would be great.
Absolutely. And Courtney and I have worked together around this exact weaving. But certainly one thing is, the MASS team and then those TSA, they are looking at, do they qualify for HOP? And if they don't, right, they're looking at Back at Home, because we're not going to both provide that housing case management, right? That would be a duplicate of services. But there are some things that Back at Home can do that HOP can't do, and vice versa. And I think that's where Emily's saying that please reach out to me, Courtney, right? And we can kind of navigate those waters. And some of that goes back to Courtney's question previously. Courtney, I was going to get back to you on that, was where in Henderson County are there some, getting, I think you said like household items, right? And in the past, that's a way that Back at Home and HOP have weaved some of those services, that there might be some healthy home goods that can be provided that Back at Home isn't able to provide. So absolutely. And it's complicated, and it's kind of case by case. So we're happy to kind of do those case by case.
Thank you. Thank you so much. And it's incredible how rapidly time flies when you're answering questions and just discussing very important information. It does truly take so many partners working together to ensure everyone has what they need. And two of those partners are United Way in North Carolina and the American Red Cross. With us, we have Michelle and David, along with James with the Red Cross, United Way. And Michelle and David, can you all share a bit more about the support offered by United Way for those in Western North Carolina?
Absolutely. How you doing? My name is David Mercado. I'm the Senior Director of United Way of North Carolina, NC 211. So I'll talk briefly about the services of the phone calls, and then I'll pass it over to Michelle in regards to the resources. So right now we currently offer a 24/7 operation where anybody, any North Carolinian can call in and look for any kind of resources. And that's across all 100 counties for the state. But, especially what we ended up doing was we created a disaster line. So when people were calling in, they would be able to get assistance a little bit quicker, depending on what it is. And we partner with different communities to get resources up to date. And our goal is just to make sure that we're the light to the consumers that are calling in. Notice how I call them consumers, because when you're selling a product, you will treat them with a little bit more dignity and respect, where people feel like, it's hard for them to call in. Currently, right now, we have a staff of 32 customer service representatives that are answering around the clock. Our goal is to make the wait time as minimal as possible. So currently, I think the wait time is 28 seconds when they call in, and that's 24/7. And we want to make sure that when they're calling, that we're giving them the most up-to-date information, providing empathy, letting them know it's okay. And giving them that hope. So I'm going to pass really quick over to Michelle, where Michelle will talk about the resource aspect of everything.
Thank you, David. So as David mentioned, in the beginning of the disaster, we were activated by the governor to be a hotline for the hurricane for general information and resources, as well as being the intake for folks looking to check in on their loved ones affected by the hurricane. And as of today, we've had over 16,000 calls related to Hurricane Helene. In the first couple of weeks, we had a lot of resources for immediate needs, but since then, most of them have stopped offering their services. So we're now starting to work on resources that are catered to long-term recovery, updating and verifying our current resources, and adding new resources.
Thank you, David and Michelle. We also have James with the Red Cross. James, would you like to share some details on the ongoing support that is being provided in the region?
Thanks, Carolina. Yeah, we were here before the disaster, obviously working in the community, and we'll be here afterwards, working alongside great organizations like United Way, and many of you on the call as we work together as a whole community to do this. So we're starting our transition now from response to recovery operations. So during that period of time, we were able to support thousands of shelter stays and hundreds of thousands of delivering hundreds of thousands of relief items across North Carolina. And worked with our partners to deliver more than 1 million meals and snacks. So just for context where we are in terms of assessments, so we've assessed visually assessed approximately 17,500 homes in North Carolina. Of that, we estimate that approximately 2,900 of those homes would be assessed as either destroyed or suffering major damage. So just for context about where we are. So our work now is really focused on finalizing the launch of financial assistance for residents whose homes were destroyed or actually experienced major structural damage. So that's happening now. We believe tentatively that financial assistance will begin on or about December the 2nd and run through December the 23rd. We will have a formal long-term recovery program in North Carolina, and we're working on developing that structure now. We'll be hiring a local long-term recovery team in impacted communities and expect to be running that long-term recovery program for the next 2 to 3 years. And that program could include both additional financial assistance and a grant program. So more to follow on that, and you'll obviously hear more about it as we stand up. We're doing all of this work alongside partners, and so just a shout out again for NC VOAD and your local long-term recovery groups that are working in this. This is the place and the opportunity to work alongside other community organizations that are working to meet the whole need that exists out there for our friends and neighbors across the state. So I was asked to talk a little bit about material resources. We've delivered a lot of resources, as I've said, and we actually work very specifically to make sure that we ask what people needed, right? So and so that actually resulted in a lot of very unique things that we delivered, to include generators, water purification tablets, wood stoves, phone chargers, jerry cans, thousands of tarpaulins, bear-proof containers, so containers for people that are concerned about that. So a lot of stuff beyond that. We still have community care stations that are open now, and I think Marguerite, if you're still on the call, should put a link in. We can put that link back in the chat where you can find those community care stations. Those will be open for a bit yet, providing additional resources. We're looking to find a home for our remaining resources. I don't know how many we have left at this point, but we've been working with some of our local community partners to find a home for things that we might have left over in our inventory. So we're working on that right now. I think what I would finish with is just really strongly encouraging, if you're not connected with a long-term recovery group, I would really strongly encourage you to do that. NCVO is a great place to start and can help you get connected, and that's what I have.
Thank you so much, James, David, and Michelle. I do see a question from Gabby as well. Thank you, Gabby, for your question. We will be following up with a list of resources and information from all our guests, and we'll be able to email those after our call today. And it sounds like this may be a question for you, James. Do you know if there is a developing list of long-term recovery groups in the works?
Yes, we can help you get connected with that. I can put my email in the chat, or we can send that out to help get you connected. Certainly would connect with FEMA partners as well. They're very active in the field working with those long-term recovery groups. So just connect with us locally, and we'll make sure that you get connected if you're not connected now, and connect with NCVOET as well, who also maintains a list.
Thank you. Thank you so much. And to answer Rosalie, your question in the chat, how do you sign up to be on the email list for NCDHHS to receive the resource information from this call? We have access to the emails for those who are on the phone and those who signed up to join the call. We should be able to respond or at least reply and send all of these resources to you all. So thank you so much for your question. I know we're at time, and I definitely can speak for all of us at NCDHHS when I say that we are in awe of our community in North Carolina and how each and every single one of you is stepping up to help each other. Thank you to those of you who asked questions and offered feedback, for your transparency, and to our many panelists for sharing the amazing work that is going on to help Western North Carolina recover. We also know that we were not able to get to all of your questions today, but we'll work to provide answers in the coming days. We're all very dedicated to supporting you in the ways that you need most. We're going to wrap up this session, and we welcome you to join us as we continue these conversations to ensure resources are being provided where and how they are needed most. Our next webinar and teletown hall will be on Wednesday, December 11th at the same time. So please mark your calendars and join us then. Thank you so much to everyone who shared, both as panelists, as community members, for helping us understand the gaps and for helping us collectively overcome this difficult time. Take care, and we'll see you next time.
Recording stopped.